So, like ASIS is the one of the easiest one you can find, right? The top one. And from there, you can move your fingers inferiorly to find the AIIS now, right? And you can feel the tendon of the rectus femoris there. And from the ASIS, you can move along to feel all the iliac crest, and it's go wrapping around to the posterior side to it too, right? And from the ASIS, if you move like the 2-inch apart along the iliac crest, so then you can feel the tubercle. So ASIS, and iliac crest is along, right? And like about like 2-inch apart from the ASIS on the lateral lip, and you can feel the tubercle. It's easy to feel it usually. And how do you palpate the iliac fossa? You need to go deep on your finger from there, right? It's the same thing. You need to have your patient relax their leg on the pillow, not like this, yeah. And you're gonna go to the ASIS and then hook your finger in. Sometimes you can easily feel it, or if you cannot, you're gonna ask your patient to take a deep breath in and out again to actually go. Okay. All right. And then the pubis. So you need to get a consent from your patient first.
Yeah.
And you're gonna ask your patient to find the first bone. They can hit it, and if they want to, they can cover themselves with the other hand below, and you're gonna replace your finger with that. Then you can kind of feel the in the middle of the bone, right? So that's gonna be the body of the pubis. And then right by there, there's a tubercle, you can feel it. It's usually tender for your patient. And then if you move further along laterally, then you are on the superior pubic ramus. And from the tubercle and body of the pubis, you're gonna move along inferiorly but lateral. So then you are on the inferior pubic ramus. It's the same thing. Once you stay on the bone, you're gonna be fine. But like along the way, you cannot miss it and then slip your finger out, then you are not going toward there again, just to directly. You're gonna ask your patient to find the bone again to make sure that you are not touching anywhere you shouldn't do. And sometimes for the male body, you may need to ask them to adjust themselves, and you're gonna just turn around, can I get you to adjust for yourself? And then they can adjust it, then you can palpate it, right? So it's more of the consent part that is more important than actual palpation is not that hard. And the pubic tubercle comes quite often for the both of them, so you guys need to know how to do it. And then, okay, we can move on to the femur. So the greater trochanter is gonna be easier for you to feel it, right? The side of their hip. Like if you don't really feel it, then you can just ask your patient to medially laterally rotate their femur, then it's gonna be easier for you to feel that one. And then you can palpate the lesser trochanter, not like this way. You shouldn't put your leg on the top of it. You need a pillow, right? And they can relax. Thank you. So mostly like figure, once you make the figure 4 position, you can tell there is a ASIS and then the pubic tubercle, then there's an inguinal ligament, right? And there's just sartorius muscle straight down now to here, and there's an adductor, longus tendon easily feel. So you can kind of draw the triangle shape here, right? So femoral triangle, and the base of the femoral triangle in the middle line where the inguinal ligament is, and you're gonna go deep into the middle line, then you can feel I can feel the tendon right away, like the lesser trochanter, right? So usually you can feel the tendon or like a little bit of the bony structure sticking out there. So as long as you can landmark the triangle and base, close to the base, and then halfway, and then go deep in, it's there. Okay? But like when you feel the pulse, so then where you are on it, you are on the femoral artery, right? So then you need to slide your finger a little bit medial and lateral to find the bony structure, not collapsing the artery too long, right? It's not good for your patient. And then